Glucometer.
Hello, I'm Angie Lomeli and I am an EMS instructor. I'm presenting you with a series of EMS educational videos. Now, whether you are a first responder, a student, or just someone simply interested in learning more about the wonderful world of EMS, these videos are for you. Now, the videos are made so that you may watch and follow along as well as practice while watching. Hopefully, you'll find these videos helpful during your lab skills and testing. Good luck with your venture, and let's get started.
Performance objective. Rescuer will demonstrate their ability to assess and treat a patient with an altered mental status. Taking more than 15 minutes is a fail for this skill. Conditions. The patient is conscious, sitting, and disoriented. The scene is safe.
Personal protective equipment. Glucometer kit. Glucometer. Lancet. Test strip. Lancing device. Alcohol prep pads. Sterile gauze. Bandage. Sharps container. Glucose paste. Sugar. Germicidal wipes.
The skill begins when the rescuer states, "I would perform penman." I will observe the patient to form a general impression before making contact.
Rescuer states, I would perform penman. Rescuer states, I observe the patient to form a general impression before making contact. Rescuer's perception of big sick versus little sick.
To get a better understanding of what you are looking for, low blood glucose or hypoglycemia may include signs and symptoms of irritability, nervousness and trembling, confusion, combativeness and psychotic behavior, appearance of intoxication, drowsiness, weakness, uncoordinated movements. They could also have a weak, rapid pulse, and their skin signs could be cold and clammy. The patient could also show signs of seizure or possibly a state of unconsciousness. I'm also looking for signs of high blood sugar or hyperglycemia. It could include diuresis, polydipsia, tachycardia, deep and labored breathing, orthostatic hypotension. Skin signs could be warm and dry mucous membrane, acidosis, that is, breath that smells like acetone, reported weight loss, altered level of consciousness, abdominal pain, nausea and vomiting, and in some severe cases, coma, also known as diabetic coma.
Hypoglycemia versus hyperglycemia. Low blood sugar, hypoglycemia.
Rescuer states, signs and symptoms of hypoglycemia include irritability, nervousness and trembling, confusion, combativeness, psychotic behavior, appearance of intoxication, drowsiness, weakness, uncoordinated movements, weak and rapid pulse, cold and clammy skin, seizures, state of unconsciousness.
High blood sugar, hyperglycemia.
Rescuer states, signs and symptoms of hyperglycemia include polyuria, polydipsia, tachycardia, deep and labored breathing, orthostatic hypotension, warm and dry skin, dry mucous membranes, acidosis, acetone breath odor, reported weight loss, altered level of consciousness, abdominal pain, nausea, vomiting. In severe cases, coma, also known as diabetic coma.
Hello, my name is Angie. I'm an EMT. I'm going to help you. After completing my initial assessment, I will determine that this patient's mental status is impaired. It is important to check the patient's blood glucose to determine the reason why they have an altered mental status and information on the function of the patient's metabolism. I would be looking for a normal reading between 80 and 120 milligrams per deciliter.
Rescuer states, "Hello, my name is... I am an EMT. I'm going to help you." Rescuer states, "After completing my initial assessment, I will determine that this patient's mental state is impaired." Rescuer states, "It is important to check the patient's blood glucose to determine the reason why they have an altered mental status and information on the function of the patient's metabolism." Rescuer states, "I would be looking for a normal reading between 80 and 120 milligrams per deciliter."
To calibrate your glucose meter, the glucose meter will come with an instructional booklet, and this one has two types of control solutions. There's a level 2 and a level 4. Another important thing to notice is that the count forward 90 days from the date you open the bottle. So it looks like anytime you open up a container, you're going to have to replace it within a few days to make sure you have an accuracy of calibration. For this glucometer, we're going to place the test strip, and I do not have one of those controlled liquids, so I'm just using a simulated type of bottle, and you would put the drops there. Once you put the drops, you're going to get a reading. The reading will coincide with the information provided right here. It says normal level 2 is between 105 and 159 milligrams per deciliter. Now, if I had the level 4 bottle, then you would have a higher number that would range between 258 and 389 milligrams per deciliter. And that's how you would calibrate this glucose meter.
Calibration, quality control.
Note: not all glucometers are the same and may require a different method for calibration. Rescuer states, "Before I use the glucometer, conduct a quality controlled test. 1. Turn on the glucometer. 2. Ensure test strip and controlled solution is not expired. 3. Insert the controlled test strip in the slot of the glucometer. 4. Lightly roll the controlled solution to mix. Do not shake. 5. Place a drop on the test strip. 6. In about 5 to 6 seconds, the glucometer will display a number. 7. Verify the number calibrated to the number range on the strip container. 8. If the numbers match or are within range, the rescuer may continue with the blood glucose draw. 9. Disposes of controlled test strip."
Now you can lay out your equipment any way you want, but I'm using this disposable absorbent pad just to create a semi-sterile location. I have my gloves on. I have my glucometer right here with the on-off button. I placed a testing strip here. If you need more, keep your contents nearby. This is my lancing device and your lancets. Alcohol pads, a 4x4 to wipe off the first drop of blood that might be contaminated with alcohol. You will cover the punctured wound area with a bandage, your pick. Have some glucose or anything sugary around in case you have somebody with hypoglycemia, which is very dangerous. And last but not least, have a sharps container so you could dispose of your used lancet and test strip. Glucose meters or glucometers come in different shapes and sizes, different manufacturers and different models. Be sure to read your instruction manual for more information and guidance. This one is pretty easy to use. It comes with a testing strip, and you place it at the port located at the bottom of the glucometer. Within 2 seconds, you should have a blinking blood drop, letting you know it's ready for you to place the specimen at the end of the test strip. The test strips will come in a little container like this, and be sure that you notice the use by date. In this case, it is 2021, next year, on October 31st, Halloween. Right now, we're in September of 2020. Please note there is a difference between use by date and the discard date. For this product, the test strip must be discarded 6 months after the container is opened. If the container was never opened, this product should not be used after October 31st of 2021. What you want to do is prepare this ahead of time. You're going to remove the cap from the lancing device, and you're going to take one of the lancets and you're going to place it inside. On the tip is where the needle is. You're just going to twist and pull. Be careful to hold the tip of the cap so that you don't poke yourself. Insert it and turn it tight. Now here is where you can control how deep the needle should go in. That is set up at 6, which is pretty deep, and you can go all the way down to 1. The manufacturer recommends 3 to 4. I'm going to set it at 4.
Warning, the following scene contains a small amount of human blood.
Once my glucometer is ready, it's time to select a finger. I'm going to avoid using my thumb or my index finger since those are the most used. You also want to avoid using the pad of your finger or the top portion of your finger. Instead, you're going to go lateral to the pad. First thing you do is clean the area by using an alcohol prep pad. If you open it at the half point, you should have the pad ready for you to take. You're going to rub the surface briskly and let it dry. Both the friction and the alcohol will help sterilize the area. Now you're going to take the lancing device. Mine is set at 4. I will place it at the targeted area, and if for whatever reason your lancing device is not activated, you could also pull it. And I could see that because the button is out now. I'm going to place it in the targeted location, and the spring action will cause the needle to come out. I'm going to squeeze my fingertip, and hopefully you're not squeamish. If you are, stop looking. You're going to rub off the first amount of blood that comes out, and now you're going to squeeze a little bit more, and you're going to take your glucometer and place that drop of blood at the end and wait about 5 seconds. And my reading is 97 milligrams per deciliter. Once you have collected the blood sample, place a sterile gauze. Put pressure for 30 seconds and then place the bandage. Now your finger has received a little bit of a trauma. It's basically an open wound. So what you want to do is you want to take a Band-Aid and cover that wound. So that way you can prevent disease transmission from the injured site to another person or a surface, and vice versa. You don't want anything to contaminate that open wound. Now you will dispose of your biohazards. You're going to take your sharps container and open it. The first thing you can do is take the test strip out of your glucometer and put it inside. close the container. The next thing you do is take your lancing device and open it. Carefully remove the lancet. Open up your biohazard sharps container and place it inside and secure it. Now, you cannot put your pads in there. So what I tend to do is I will get the gauze and any remnants of any materials, including some of the bandaging material, and I pinch the portion of the glove at the wrist, and now I have contained some of that biohazard. Carefully create a wad again, and I stick my fingers underneath my glove, and now those items are double contained. And when possible, if I have a biohazard bag or any other kind of bag, I make sure that I throw them in there and I tie it up at least until I can find a biohazard bag and dispose of it at that point. The last thing you want to do is that anything that would have been near the blood should be cleaned. I'm going to use a germicidal disposable wipe. I'm going to take 2 out, stage 1 on top. I use the first one to wipe down the glucose meter. And I'll put that down, let it dry. And then I will clean the lancing device. I did put on new gloves. Allowing it to air dry is really important. I will take these 2 and also double contain. Once these are dry, I can put everything away. And I will also package these and put them in a biohazard bag.
Glucometer application.
Rescuer states, I'm going to collect a drop of blood to use with the glucometer to determine your blood sugar level. Rescuer prepares all equipment and supplies on a clean surface to include 1. Ensures glucometer is on. 2. Inserts a new test strip into the glucometer. 3. Inserts a new lancet inside the lancing device. 4. Lancing device is set at desired depth. 5. Stages alcohol pad. 6. Sterile 2x2 gauze. 7. Bandage. 9. Sharps container. Rescuer states, I will cleanse the selected finger with an alcohol pad on the lateral side of the finger. Note: avoid the center part of the finger pad and the fingertip. Rescuer states, I will use the lancing device to obtain a blood sample. Holds the patient's finger and places the lancing device in the cleansed area and activates the spring action. Rescuer states, I will squeeze the finger to draw blood and wipe it off with a 2x2 gauze. Note: the first drop of blood may be contaminated with alcohol and result in an incorrect reading. Rescuer states, I will squeeze the finger again and I will place the next blood specimen on the test strip. Holds the glucometer and places test strip on the drop of blood. Rescuer states, I will place the gauze on the fingertip and advise the patient to place direct pressure for about 30 seconds before bandaging. Rescuer states, I will read the glucometer and record results on the patient care report. Verbalizes where in the normal glucose level range the reading fit into. Rescuer states, I will dispose of the lancet and the test strip in the sharps container. Rescuer will wipe down glucometer and lancing device with germicidal wipes. Rescuer will put away all the equipment and supplies properly for the next use.
As a habit, I try to keep things with sugar near me anytime I'm near my family or friends or even coworkers that have diabetes. If they're showing signs of low blood sugar, maybe they took their insulin and didn't eat enough, or they ate quite a bit, but they used up all that energy, and then they start to act a little cranky or confused or upset over little things that aren't that important, I make sure I have some honey, a sugary drink nearby, maybe some pancake syrup, other types of honey packages like from KFC, some hard candy. And not everybody walks around with this glucose paste. And for most of my medical calls, I try to keep a candy bar around because nobody wants to eat this. This is a lemon flavored glucose paste. They come in 15 or 45, a little bit stronger sugar levels. But let me tell you, I've tried this myself and I'm not a big fan. So I would rather eat something more natural tasting, like pancake syrup. I keep these around just because you never know who's going to have a diabetic emergency. Before you offer the patient any type of sugary beverage, food, candy, make sure that they could actually swallow without aspirating or choking on the product. This is only good for someone who has low blood sugar or hypoglycemia. Now, if somebody has too much sugar in their blood, well, at that point, you won't make it any worse. So the worst of the two is hypoglycemia. So make sure you have something sweet, something sugary, not a diet beverage, for them to consume if needed.
This concludes your instruction.
Thank you for watching Lomeli EMS Productions. I hope you enjoyed the training video. We look forward to producing more in the future. Remember, live for today, learn for tomorrow.